business owners and executives from around the Valley. This is Business Leaders with Lance Cardoza.
Good morning, everybody, and welcome to Business Leaders. I'm Lance Cardoza, and my guest this week is a very exciting story. And what I love about this business, Fresno CBAS, Community-Based Adult Services, is what they do for our community. And during a time of pandemic and out of a pandemic, and we're not sure and uncertain of this climate in today's society, here's an organization that's helping people with disabilities from 18 years until the golden years. And Suren Shaginian?
Yep.
Did I say it right? I got it close.
Yeah, Suren Shaginian. You got it right, yeah.
Perfect. Your family's a great family. I've met them through Savak Kachatourian, owns the Pacific Southwest building downtown. Mm-hmm. And in the beautiful ballroom, you have this business called the Fresno Community-Based Adult Services. So essentially adult daycare, correct?
Yes, yes.
Okay, and tell us a little bit about that, Fresno CBAS, and how that concept that you guys brought to Fresno, how much of an impact it's made to our community and also to yourself. What does it do for you? Yeah.
So, it all started, this project started a long time ago with the owner, Hirak Benjamin, who was living in Los Angeles, and his goal and aspiration was to kind of create a program that was targeted for the low-income, underserved populations in Los Angeles. So the needy communities, these are people who they don't have access to healthcare, and he wanted to create a program that was going to provide equitable services and just provide resources to them. Mm-hmm. So he came out to Fresno and he met Savak Kachatourian, as you mentioned. Yeah. He has the beautiful ballroom building with the Pacific Southwest building.
Gorgeous, and that's where the center is.
Yes,
right there. It's
yes,
beautiful.
We're in the spacious building. So, they talked it through, and it was fantastic that their motivations were aligned, and they wanted to bring this goal to Fresno. And they want to service all of the underserved communities in Fresno County. So it's been a long project, but it's been about 5 years. We've been going hard at it, and we want to serve all of the low-income people in Fresno County, and want to make sure they have access to healthcare services. They have equitable services and the resources, and especially in COVID-19, we've tried to aim towards the senior population, for the individuals that are developmentally disabled, or just any individual who is low income and has Medi-Cal. Yeah. And we want to make sure they have access to these resources.
And who qualifies for this program with Fresno CBAS?
So any person, like you said, above the age of 18, they qualify. And if they have Medi-Cal, they have any problems with their activities of daily life. What this means is, on their worst day, can they cook? Can they clean? Can they bathe? Can they get in and out of bed? And if they have trouble with this, then they qualify. Or if they have diabetes, or if they have hypertension. So as long as, like I said, they have Medi-Cal, they have problems with their daily activities, and they have a physical address, they fully qualify for the program.
Great. And I see Hirak and Savak, and they both have a passion. Hirak, like you said, he wanted to help the underserved community, and how he bonds with people when he walks through the building. A lot of the people that are going there, it's like a family.
Absolutely.
Yeah.
We want to create an environment where people feel like they're coming home. And especially with COVID, it was, you go out to the community, you speak with these people, and you see the difficulties they are undergoing in their daily life. Some of them, they have just one lunch the whole day, or sometimes they don't eat the whole day. And some of them, they haven't, gone and seen a doctor for the last 3 years. So we want to make sure that these individuals, they don't end up utilizing the emergency rooms or end up going to nursing homes where their health is rapidly going to decline. So we want to make sure we prevent institutionalization, and we want to emphasize management of their health, so they don't go down too far or they don't go too up high. So we want to manage whatever they have.
And they don't have, from what I understand, they don't have to change their primary care. So their doctor they still can keep. That's a big question. I'm sure if you're watching this at home, and maybe it's mom or dad or a family member that needs services, and you think this is great, Fresno CBAS, Community-Based Adult Services, I need to call them, and we'll have that information here with businessstreet.tv. You could take out your phone, scan the code, and all the information will be there, or you can go to the website at businessleaders.tv, and you will be able to get more information. But do you find that when people call, they're not sure exactly if they qualify or how the system works, but they don't have to change their doctor? And is that a big question in the beginning when someone's looking?
Yeah, definitely. It's something that usually they're confused, or it's a trust issue. So we want to make sure we're transparent with them. We tell them, absolutely, you keep your physician, you keep your doctor, you keep your specialist, you keep your caregivers. We just enroll you to a managed care plan, which is a safety net for you, that is an added resource for you.
Perfect. And your role, what's your role there in the center with Fresno CBAS?
So my role, I'm the administrator at the facility. I ensure patient safety at all times. So making sure the federal and local state laws we're following, and at all times we're ensuring we have quality healthcare services or any type of resources we're providing for the participants.
So tell me, if someone is watching this show right now and they say, I have somebody or I know of somebody that can utilize these services, one, you could again go to the website businessleaders.tv and scan the code and we'll get you in contact with them. But what's the first step that someone needs to take?
So the first step, they would just call. So just call our office phone, and you would speak with one of our program aides or our social worker assistants, and they would walk you through the process of doing a screening and ensuring that you qualify for the program. And once you do, at every step we want to ensure that you know where you are. And usually it takes around 1 month. We try to do it as quickly as possible for them to benefit from these services.
To go through the program. And what do you hear from individuals that come to the center? And I see people, I've been down there and be able to see it and experience it myself. What do you hear from them? What do you think?
I think it's the excitement when they come to the program. Initially, some of them, they're confused, their energy levels are down because, like I said, they don't have access to any of these resources. So they've lost hope, they've lost faith in themselves because some of them, they don't have support systems. And a lot of that had to do with COVID. And they were trapped in their home, no support system, no family, no friends. And when they come and they start socializing with our staff members, they start socializing with some of these participants. And right now through COVID, we've tried to be as flexible, doing everything through Zoom, playing bingo on Zoom, doing physical therapy through Zoom. So trying to tailor the safety aspect of it, but I think some of them, majority of them, have been really excited to actually engage with our staff members and actually feel like they're a person.
Absolutely. So, Surin, we're going to talk more about Fresno community-based adult services right here on Business Leaders. If you'd like to see past episodes of Business Leaders and find out more information on how you could get somebody involved with Fresno CBAS, come right back right here on Business Leaders on KMPH Fox 26. Welcome back, everybody, to Business Leaders here at KMPH Fox 26. And my guest, Surin Shaginian, with Fresno CBAS. And CBAS is community-based adult services. And we were talking about anyone from the age of 18 and above with 2 underlying conditions. And they're really, it's recommended from their physician. So they don't change their physician to be able to come to Fresno CBAS. But you're playing really like an assist in their adult health care, correct? And so with that process, we were talking about how someone starts that process, or how do I get involved? I know that sometimes people think, I don't qualify for that, but sometimes they'll be surprised, correct?
Yes, absolutely. Some of them, we come across individuals that maybe, at the age of 5 years old, until the age of 40, they were farmers. And physically, they might not look like they qualify, but when we go through our process, we want to make sure these individuals, we speak for them. We're a voice for them. We want to ensure they have access to these healthcare resources. We want to ensure they have access to these community resources that they could benefit from.
And the state implemented organizations like yours, Fresno CBAS, and they're located at your downtown, the beautiful Pacific Southwest building, and the ballroom, and that's where you are, very spacious, a lot of fun activities, a lunch that's made by an executive chef. It's taken care of for the participants of the program. It's a beautiful place. The state implemented this to help mitigate from hospitals having overflow. Maybe somebody has a headache or they're not feeling good, or it's a mental anxiety that they're going through at the time Is that part of the reason why they implemented programs like this?
Yes, absolutely. The state is moving away from, institutionalization and away from individuals using, emergency rooms or ending up in nursing homes because it is very costly for their family members and the patient as well. So they're moving towards this model of care that they, an organization that's going to give them a bundle of services where they could go to one place where they could get physical therapy, they could get nursing services, social services, they could do activities, and at the same time, they could get a meal that is, tailored by a registered dietitian.
So again, like if they're diabetic, you mentioned that, so then a meal is tailored towards that for diabetes, and maybe that could be one of the issues is having their diabetes under control?
Absolutely, yeah. So
Okay.
some of them, we want to ensure even to the caregivers that our registered dietitian, he's the one who creates the menu. So everything is portioned out. If they have diabetes, correct, they do get a diabetic meal. So it's one less lunch the caregiver has to prepare.
Okay.
And that's something that the caregivers have been enjoying as well.
You mentioned physical therapy. So if a patient, would it be a patient or a member that comes down, if they are already receiving physical therapy but maybe can't get in enough, so you play assist in that too, and you have physical therapy there at the center?
Yes, so we want to make sure that we're flexible with the patients. So some of them, if they're still in fear of COVID, we want to make sure they get physical therapy in a virtual setting. So our physical therapist is at all times available via Zoom. And if they're comfortable, they could come to the center for a one-on-one physical therapy as well.
And you take all protocols. I've noticed when I visited the center for COVID and making sure that everybody stays safe, including the employees of Fresno CBAS and the patrons that come to the building. And what's nice about the Banker's Ballroom is it's a big open space and it's a beautiful place. And they still have weddings. There's weddings and events on the weekend and Fresno CBAS during the week.
Yeah, yeah.
So you guys are pretty lucky to have that type of facility, because most facilities that I've seen like this, they don't have big, beautiful vaulted ceilings and be able to have your day in a ballroom.
Yeah, and that's one of the things we want to emphasize is the spacious ballroom. So patients could come and they could choose wherever they want to sit in this spacious area.
Yeah.
And they don't have to feel congregated, touching, next to each other. So it's that aspect when they do come in. That's one of the things that we've been getting is they look around and they're amazed how beautiful it is, and actually being able to sit wherever they want in the comfort in their own. They're very comfortable actually.
And still participate in the activities, because
Yes.
I've been there when I've seen people spread out and they can still participate or be in a different activity. Maybe it's solo or something else, doing a puzzle or whatever it is. So it's a beautiful place, and it's amazing what you guys do. There has to be a passion, Suren, that pulls at your heart that says that I'm good at this, or I want to solve a problem. What is that in your life that made you want to be in this field?
I have to thank my parents. Both of my parents are immigrants, and when they came to Los Angeles, they practically had nothing, no resources, no public resources at all, and they were struggling. So for me, all my background, all my academic background is in public health. So I bring that passion from my parents, and coupled with my education, I want to be able to speak for the vulnerable communities and speak for some of these individuals that they might think they're not entitled to this healthcare. And for me, I believe every single person deserves the right for healthcare, and they should have access to equitable healthcare services. Whether you live wherever you live in Fresno County, we want to be the voice for you.
And do you find too a lot of people that are in a situation during the pandemic, that a lot of people that need these services need them more than ever, and either are afraid to still leave their door because of Omicron and everything else with going out there? Do you see where they're a little scared, and that's where they have the opportunity to do the virtual?
Yes, when we initially opened during COVID, I think that was the biggest thing for some of the patients that didn't want to come to the facility. So we decided to be as flexible as possible and take all of our services and deliver it to their home. And it included, the daily lunches. It included the activity packages that they got. It included the physical therapy and nursing services. It also included things such as food banks, food boxes. We didn't want these individuals to go to the food bank, so we want to deliver everything to their home.
Beautiful. Suren, we're talking about Fresno community-based adult services. And if you'd like to find out more information, take your mobile phone out, scan that QR code, or go to businessleaders.tv. More to come. Don't go away, right here in the studios at KMPH Fox 26. Don't go away. Welcome back, everybody, to Business Leaders right here at KMPH Fox 26. My name is Lance Cardoza, and I've been sitting here with Surin, and Surin is with Fresno Community-Based Adult Services, and you're the administrator, and there's more people that take care of everybody at Fresno CBAS. Talk to me about some of those jobs that you have. I know there's nurses there, and there's physical therapy. Can you talk to me about the organization?
Absolutely, yeah. So, we do have a registered nurse. We have our social workers. We have our, physical therapist, as you mentioned, our registered dietitian. We have a licensed clinical social worker who goes more in depth into, mental illness and goes more into depression and anxiety evaluations. We also have a staff physician as well, and our staff physician ensures that all of the care plans and all of the care that we're providing, it's reasonable, and most of all, there's quality in those care plans that we're doing. So, most of all, on the daily basis, all of the professionals, they provide these services daily, and they could choose to either come to the facility where it's done direct, or it could be done on a virtual setting where it's delivered in the comfort of their own home.
We talked about in the early part of the episode, we were talking about you don't have to leave your primary care physician. And when you come to Fresno CBAS, you don't do that, and your social workers can explain how that process works. But the staff reports to the physician in a healthcare program, correct? And how does that work, that process?
So we coordinate with the patient's medical doctor. And if they don't have a medical doctor, we want to help the patient find a medical doctor. And this is all tailored, and it's very individualized to whoever they want to select. We want them to be comfortable with the physicians they select. And our registered nurses, they kind of coordinate with the medical doctors. And we want to ensure that the patient at all times, if we find abnormal findings with their, let's say, lab results, or anything that happens with their blood pressure or blood sugar, we want to always be in coordination with their primary care doctor.
Can you give people at home watching Business Leaders, and if you want information, again, if you want information about Fresno CBAS, Fresno Community-Based Adult Services, go to businessleaders.tv, or take out your phone and scan that QR code. All you got to do is open up your camera and scan that code. You'll see the hyperlink pop up, and you can go right to their website, and we'll have details there at businessleaders.tv. But give me a day in the life, if you will, a scenario. If someone is at home and they're needing these services and they get into the program, Fresno CBAS, what does a day look like when they come downtown to the Pacific Southwest building and they enter that ballroom? What could a day look like?
Yeah, so the first thing they do is they check in with our registered nurses and our licensed vocational nurses. And the first thing is we want to ensure that when they come in, their vitals are, they're doing well when they come in the morning. So after we do that, they could choose wherever they want to sit in the ballroom. And usually they have their designated spots because they've already made friends. So they choose to sit wherever they want. And our activity coordinator has planned activities for that day. So it could be karaoke, it could be doing bingo, we do chair exercises, we do Bible studies, and it's everything that the activity coordinator has done for that day. And the activity coordinator already knows what the patients like to do. So again, it's very individualized. So if they want to read a book, we provide them with a book. If they want to participate in, let's say, men's group or women's group, they could also do that as well. And throughout the day, our physical therapist has already plans out the therapy as well. So while they're doing their activities on a one-on-one basis, we do the physical therapy. And just around 11:30 to 12 is where we start passing out the lunches. And the lunches, again, it's tailored to their diet. So if they're diabetic, we serve that diabetic lunch. And usually they're around until 1 o'clock. So it kind of goes intermittent with doing the activities, and throughout the 4 hours that they're at the facility, our registered nurses, our social workers, our licensed clinical social worker could always see any of those patients. So it's very team-based. It's a lot of coordination amongst our team.
Absolutely, and again, with services being delivered at home and virtual services, there's a lot of coordination and put together, but it's very individualized, like you're saying. It sounds like that someone might begin delivered meals at their home and some virtual, and then feel comfortable to come down for their physical therapy and or an activity that they're very interested in, which I'm sure you have those. I see the activity board when I went in there, and I'm sure everybody has their favorite. And I'm sure if you had a Marvel night, I know you have one of your patients that would love it.
Yeah.
And you know who I'm talking about.
Yeah,
because he tells everybody about it, and would love to see him be in a Marvel movie because he's just a huge fan of it. And it's great to see that happening. And when we talk about that individual, and think about the alternative. If services weren't there for that individual, what could it be? What would it not be? Or sheltered, sitting in a home, deteriorating. So it's an amazing service. And I think sometimes, like you said, people don't know that they could take advantage of these services or be a part of that. So social workers are on hand at Fresno CBAS. And how do they find Fresno CBAS?
So they could go to our website, fresnocbas.org, and our mission is there, our goals are there, and we want to ensure, like I said, transparency for them. We want to ensure that all of the patients understand that it's in our name, community-based. This is for the community, it's for you, and you don't have to pay anything out of your pocket. And it's a resource for you. Why not take advantage of it while you can?
And if you don't know if you qualify for these services, but you know you need these services, you could always go to Fresno or Fresno CBAS,
Fresno CBAS.
CBAS.org, or simply use your phone or go to the website here at businessleaders.tv. Well, that's all the time we have this week. Surin, thank you so much for being on my program. I appreciate it. Fresno CBAS, so you can go to fresnocbas.org and get more information. Until next week, Tuesday mornings at 11 a.m., Business Leaders.